Welcome again to myiacademy.com. I'm Professor Mahfooz. In video VMCQ 7.3, we'll do the corneal MCQs number 3. Fortified eye drops mean. So what does it mean by fortified eye drops? Antibiotic and mixed antifungal eye drops, autoclaved eye drops, high concentration eye drops, low concentration eye drops, or steroid eye drops. So fortified simply means, which is in section VHB 7.2, injectable antibiotics are added to the commercial eye drops to make high concentration eye drops. So the high concentration eye drops is the answer. High concentration eye drops is the fortified eye drops. Fortified drops are used for, so remember from a common sense, for a normal looking ulcer we just give the commercial eye drops, and the stronger or fortified drops are only when the ulcer is not healing or not getting better. Here the 5 options are: improving bacterial ulcer, so if it is improving there's no need to give fortified. Marginal keratitis is a hypersensitivity type of ulcer. Murine ulcer is an immune type of ulcer. A small bacterial ulcer can easily be healed with the normal available commercial eye drops. So the answer would be large non-improving bacterial ulcer. Let's see the answer. Large non-improving bacterial ulcer. Next MCQ. Debridement of the corneal ulcer means injecting antibiotics in the anterior chamber. Injecting antibiotic in anterior chamber is intracameral antibiotics. Scraping of the ulcer, that may be the answer. Treating with fortified eye drops, this is not debridement, it is just fortified eye drops. Temporary closing of the eyelids to treat the ulcer, this is called torsorrhaphy. And using ultraviolet light for ulcer treatment, this is called PAC-CXL. So the answer would be scraping of the corneal ulcer. And it is the answer. PAC-CXL for the corneal ulcer means injecting antibiotics, we know it's intracameral. Scrapping, this is debridement. Treating with fortified is not the answer. Temporary closing, this is torsorrhaphy. So the answer would be number 5, using ultraviolet light for the ulcer treatment. Let's see the answer. Using ultraviolet light for the ulcer treatment. Next MCQ. Torsorrhaphy for the corneal ulcer means, we have already discussed in the previous 2 slides that the torsorrhaphy means closing the eyelids or suturing the eyelids together. So number 4 would be the answer. Temporary closing lids to treat the ulcer. And this is the answer. Next MCQ. Intracameral treatment for the corneal ulcer mean, we have already discussed it. Intracameral means into the anterior chamber. So the answer would be injecting antibiotics in anterior chamber. Let's see the answer. Injecting antibiotics in anterior chamber. Next MCQ is, in the treatment of corneal ulcer, cycloplegics are used to dilate the pupil, to heal the epithelium, to relieve the pain, to reduce the inflammation, or to treat the ulcer. Now look at the options. Dilate the pupil. Cycloplegics do dilate the pupil, but that is the not purpose of the cycloplegics to be used in corneal ulcers. Heal epithelium, they don't heal epithelium. Reduce the inflammation. Inflammation is reduced with the specific treatment like antibacterials or antifungals or maybe steroids. Treat the ulcer, we don't use cycloplegics to treat the ulcer. So the only option left is to relieve the pain, because the cycloplegics paralyze the ciliary muscle, so which cannot contract because of the paralysis, and you don't feel the pain. So cycloplegics are used to relieve the pain? Let's see the answer. Relieve pain is the answer. Desmatocele means. What is desmatocele means? Desmatocele comes from the descent membrane. So now see the options. Deep scarring of the cornea, not likely. Exposure of descent membrane, that is the likely answer. Non-healing epithelial defect, that's called persistent epithelial defect. Perforated corneal ulcer is perforated corneal ulcer, and spread of the infection inside the eye is endophthalmitis. So here desmatocele means exposure of descent membrane, and this is how it looks like. The whole cornea is thick, but the cornea is melted down here and the descent membrane is exposed, and we call it desmatocele. Let's see the answer. Exposure of the descent membrane. Endophthalmitis means, we already said in the previous slide that spread of infection inside the eye is called endophthalmitis. It can be because of the ulcer or it can be because of the surgery done on the eye. So the answer would be spread of infection inside the eye, and it is the answer. Next MCQ is, bandage contact lens is used to treat deep scarring of the cornea, new vessels on the cornea, non-healing epithelial defect, seeding in the anterior chamber, or spread of infection inside the eye. Bandage contact lens is used for the non-healing epithelial defect because they protect the front of the cornea and let the epithelium heal. So number 3 would be the answer. Let's see. Non-healing epithelial defect is the answer. Bandage contact lens is used to treat deep scarring, no. New vessels of the cornea, no. Seeding of the anterior chamber, no. Spread of the infection in the eye, no. So the answer would be small perforation in the eye. If you've got a small perforation, you can temporarily treat it with the bandage contact lens till it heals. So the answer is small perforation in the eye. Blood serum eye drops are used to treat deep scarring of the cornea, new vessels in the cornea, non-healing epithelial defect, seeding in the anterior chamber, or spread of infection. My answer would be non-healing epithelial defect because the epithelium is not healing. So the blood serum eye drops give them all the nutrients they need to heal. So that would be the answer. The answer is non-healing epithelial defect. The next MCQ is treatment of perforated corneal ulcer. Cautery to close the perforation, fortified eye drops, keratoplasty, PEG-CSL, and tarsorrhaphy. Remember, the tarsorrhaphy is to heal the ulcer by closing the eyelids. PEG-CSL is for the treating ulcer. Fortified eye drops are for treating ulcer, and cautery is for the new vessels. So for the perforation, the answer would be keratoplasty. Also, have a look at the VHP 7.2c, which gives you the different options to treat the perforation, and the options are keratoplasty, sutures, tissue glue, amniotic membrane, conjunctival flap, and scleral patch. All these are the options for treating perforated corneal ulcer, so the MCQ may have one of these options. So here the answer is keratoplasty. Next MCQ is treatment of the perforated corneal ulcer is, remember the options, one of them was scleral flap, so scleral flap will be the answer here. It is scleral flap. You just can change this option and you can have various different MCQs. So all you have to remember is the various options for the treating corneal perforation, which was in the previous slide. Treatment of the perforated corneal ulcer is, here the answer would be tissue glue, which is one of the options for treating perforated corneal ulcer, and the answer is tissue glue. treatment of perforated corneal ulcer, and one of the option is amniotic membrane, which is right at the top. Amniotic membrane is the answer. Thank you very much for being with me. Thank you.